I would think that I didn't jump into being a doctor just to become an endocrinologist. It was a process. So as I was a junior doctor, I was rotated through different departments. And what drew me to internal medicine was because I enjoyed the challenge of looking through all the different patients' clues, their symptoms, their blood tests, their results, and piecing together what problem they may have. Basically, endocrinology is something that was very prominent in that because we really base our diagnosis and our management on patients' blood test results, their lab investigations, and it's very satisfying also to be able to journey with patients because endocrine cases are actually chronic diseases. So to be able to journey with them through their chronic conditions is also very satisfying. We get to know patients really very well through the entire journey. So that is something that brought me a lot of satisfaction, and that triggered the interest in endocrine. Also personally, I do have a strong family history of diabetes also. So I have seen my family members having to check their blood sugars, having to take medications, having to look after their diet, and that also triggered an interest to see how can I help my family through their own journey as well. Well, in Cedar Endocrine, I'm the main anchor doctor, and for me, what is important when I set up my clinic is to make sure that the patients are well looked after, accurate diagnoses are made, and appropriate treatment is instituted. But beyond that, all I want to do is to really care for my patients and to help them through their journey. In endocrine conditions, many of these cases do have chronic sequelae. So we want to be able to journey with them with compassion through this entire journey to make them feel that they are understood and to ensure that they are comfortable with me as well as my team and be able to be supported in a holistic manner through things like lifestyle changes, through medications, even cognitive behavioral therapy if needed. So these are some things that I would hope to be able to achieve when I journey with patients when they come through my clinic. So for example, we do have patients who have not seen me ever and they are worried about their thyroid, for example. So in those cases, what will be done is, firstly, we do need blood investigations to confirm, hey, do you really have a thyroid problem? And for that, we will need some blood tests. A nurse will be coming to the clinic to help draw the bloods for my patients. They'll be sent off to be run, and then sometimes if the patients do have any other symptoms that warrant the ultrasound of the thyroid, we can do it for them. We can also perform fine needle biopsy of thyroid nodules if the need arises. So that can be done in my clinic, or we can also decide whether we want to admit patients to have this procedure done as well. So besides thyroid, we also see patients with diabetes, and at the first consultation, I tend to want to understand my patient's lifestyle. What is their needs? How busy they are they frequent flyers overseas? Do they work shifts? So all these help us to decide, okay, what will work best so that patients can keep on consistent and sustainable kind of a treatment plan. So that's how we manage our diabetes patients. In terms of any other medical conditions, for example, some patients come and see me for weight management as well. We do acknowledge that weight management is a multifactorial problem, and we do need a multidisciplinary kind of a team to be able to help patients sometimes. So I would usually work with a few dietitians who can advise on what kind of a diet will work best for certain patients, and we also can discuss medications which would be beneficial to my patients. So at Cedar Endocrine, patients do come to me from various sources. Some do have other patients who are friends who are already seeing me and they are recommended to come and see me as well. Or they could have Googled and found me online. So after they have decided they want to come and meet with me, my staff is going to be able to answer their queries through WhatsApp or through a phone call. we do have an online form that they can fill in first, and they can submit it to us, and we can help to reply to their queries first. So that's the first step. After that, they will be coming to my clinic after setting an appointment, and at the first visit, what we'll do is we'll register the patient first, and at the first consult, usually what I will do is we do need to get to know each other a little bit. So for patients, I would want to know a thorough history of their background medical condition, their symptoms, and if they had done previous health screenings or any blood tests, they have other results from other doctors, it'll be really helpful to be able to bring those, and I can look through those tests with them. And from there, we can tailor to what the patient actually needs, be it doing further blood investigations or any scans that we need for example, thyroid conditions. So those are things that we may further do or order for our patients after the first consult. We also know that our patients' time is precious, and we usually would try to make it convenient for patients. If we can, we usually will do a blood test that is necessary on the day of the consult, or we can try our best to arrange for scans that's needed within a few days of meeting the patients. The results will therefore be out quite soon most times, and once the results are out, I'll discuss with the patients through either a phone call, a teleconsult, or another visit with me to go through their results and decide what further action is needed. Well, at Cedar Endocrine, I think what we want is to be able to journey with our patients through their condition and to let patients know that our treatment plan is really in their best interest, and ultimately we want to achieve good health outcomes together. Something that's sustainable for patients to continue and eventually to be able to know that they are at a better place from their health perspective. So that's one important thing. In terms of take-home message for patients after they see me, of course I do want that they feel comfortable with me, because we want to build a good long-term relationship with patients. So I wanted them to come away feeling that they can confide in me in how they feel. They do not have to feel judged when they come to see me, and the decisions made here are really in their interest, as well as it's a joint decision making as well, something they as well as us decide that is best for them. So that's important, a joint decision making kind of strategy. Cedar Endocrine Clinic is located in two places. We are at Mount Alvernia as well as at Mount Elizabeth Orchard Hospital. So at Mount Alvernia, it's actually near the Thompson area. If you are located somewhere around the Bishan, Toa Payoh, or Ang Mo Kio area, that will be somewhere that may be a bit more accessible for you. Well, if you happen to work in town, Mount Elizabeth Orchard will be a little bit more convenient. It's very near to Orchard MRT station, so do drop by, okay, if you really need to seek my help. You can always WhatsApp us. My friendly colleagues will be able to attend to your enquiries, and we strive to reply to you as soon as we can.